started. So all of you work with weight loss patients every day. So from that experience, what's something you wish every patient knew before they ever took their first dose?
Breakfast. Please eat breakfast.
Do you all do 3?
Eat regular meals. You have to eat. You're not going to lose weight well without eating.
Correct. 3 meals a day.
3 meals a day.
The first one, eat whatever you want.
Yep.
I don't care, a donut.
I tell the patient the same thing. I'd rather you eat a donut than eat nothing at all.
Yes. Yeah. The carbs are okay in the morning. Carbs are not okay in the evening. Do not go to sleep eating sandwiches or pastas. It's just, that's not a good idea.
And a scientific reasoning for that, your insulin response is the best in the morning. You're sleeping at night, 7 to 9 hours, if we're doing it right, which
Some
people don't.
Right.
But average human should sleep 7 to 9 hours a night. That's a fast, guys. That's a fast. And so they call it break fast breakfast for a reason. And so you're breaking your nighttime fast of sleeping. So when you wake up, you can break a fast. Eat what you want. Eat some carbs. It's okay. Your insulin is responsive. It can handle it. You will burn through those carbs before the day is over. But here's the trick. Stop the carbs after breakfast. This is where we turn the switch on. This is where we're in our diet mode. This is where we get more into protein. This is where you hear people say, you have to eat a lot of protein on this medicine, right?
I agree for the most part, but I think it's okay to have some carbs around lunch. I don't think you should completely cut out carbs because you need energy through the day, depending on what you do.
Yeah.
And a lot of people, hopefully, are going to try and work out in the afternoon after work. And you don't want to be carb deprived prior to working out. It's at night.
Yeah, that's a great exception.
It's at night that I'm concerned about people eating carbs and not eating right, because again, they go to sleep, they're going through that fasting phase.
And if you don't use that for energy, it's going to store into fat.
100%.
Well, and I also feel like so many patients, when they say they have cravings, and you get into when are you having these cravings and what kind of cravings are you having? And they're like, after dinner, I am craving chips, sweets, XYZ, carb heavy, and you get into, okay, well, what are you eating at the beginning of the day? And they're like, I just had like a piece of fruit at breakfast. Or nothing.
They say nothing.
Your body is now trying to tell you something at the end of the day.
Let me tell you all something. If you're not able to eat, if the medicine you're taking is preventing you from having any hunger or eating at all, you're on too much medicine. Your dose is too high.
We need to come down on your dose. We need to talk about being hungry is normal. We're not trying to take that away from you.
Yeah.
So, being hungry 3 times a day is a normal feeling, and that is not something, again, we were trying to take away.
And I think a lot of people get confused when they first start these medicines. They don't feel that hunger because it's strong and they've never done it. And then, maybe a month later, they're like, wait, I'm hungry. It's not working. I went up on my dose. Yeah. So you need to eat to stay alive. You want those hunger prompts to prompt you to eat.
Yeah, exactly.
And people think that it's not working anymore simply because they're hungry.
That definitely does not mean it's not working.
Right.
And when you start on the medicine, you're right. You're not used to it. Your body's not used to it. It is going to suppress your hunger more. You've got to pay attention to your body. But we give people this advice about what to eat and how to eat and suggestions.
Important that you eat right on this medicine. You don't have to eat to diet. You have to eat to protect your body and stay healthy while you're dieting. And that's really something you have to concentrate on. Protein, fluids, the right minerals, eating 3 times a day.
Yes.
Sleep.
It's important.
Sleep.
Yeah.
Sleep.
Yeah.
Sleep. So we had a question in the chat. So they were wondering, how does GLP-1 work for women in menopause?
That's very important.
That comes up a lot.
It's very important, yes. When women go through menopause, they start storing fat. Their metabolism slows down. It is very important that you that you optimize or improve your estradiol, your estrogen level. So as women go through menopause, what's happening is you stop producing estrogen. Your body needs that estrogen to be healthy. The FDA has finally admitted they were wrong for 20 years. And estrogen is so healthy for women. It is very healthy for women. So if you balance your estrogen, it helps your metabolism. It helps your body maintain back to where it was before. It helps you maintain your body mass, not build as much fat. It helps you have energy. It helps your brain. And it will help with weight loss and these medicines as well.
And some testosterone too.
Some testosterone is testosterone is
So how would you say the GLP-1 along if we get into HRT in conjunction, how are they helping?
They work together.
How is it helping the GLP-1? Because it's also helping with your insulin regulation, which will then lead to also cortisol regulation and other hormonal regulation. So we get a lot of people who they start on these, just the GLP-1s, and a lot of women, obviously, and they're not losing weight, and we'll go, where are we hormonally in life right now? Do you have any symptoms of any hormonal imbalance? Are you having the night sweats? Are you having the recent weight gain in your belly specifically? Because that's usually the most common problematic area. And I think everybody else will be like, I think hormones are playing into why you're not losing weight. We can look at your labs, let's dive into that. And a lot of times we see smooth sailing take off with the weight loss when we do combine HRT into the GLP-1s also.
Yeah.
So we all know we're supposed to eat protein. Let's go beyond that. What would you say to a patient who says, I'm just not hungry? What's your biggest advice?
Back down on your medicine.
Yeah, are you
Yeah.
just not hungry at all, or like
What does not hungry mean?
What is-
Are you
right.
all day long?
I would get them to define it a little bit
Yeah.
more
Yeah.
on like
What were the
right
questions
now.
you would ask them
Well,
if they told you?
There are also a lot of people who just naturally don't eat breakfast. They haven't eaten breakfast
Yes.
most of their life.
And that's the
Yeah.
biggest
They eat
comment
small
people
lunch.
say.
Yeah.
Never eat
They
that.
eat huge dinner.
Dinner, yeah.
And
But you
that's-
gotta do it. Yeah.
even if you're not taking this medicine, that is like the wrong way to eat. It's going to slow your metabolism. You're going to store fat.
Yes.
Just a bad idea.
All right, so we have another question in the chat. So can you discuss regular GLP-1 versus microdosing and what types of candidates should consider each option?
Okay, this is kind of important to me. I end up talking people out of microdosing a lot of times, because microdosing is a way to take small doses of medicine not to lose weight. So you want to use these medicines for the potential benefit, right? So what are the benefits we're talking about?
Inflammation.
Better kidney function.
Yeah. Okay. So we've all heard about the studies. There's so many studies out there that are showing improvement in cardiac contractility. So your heart functions better. People in studies that were taking these medicines versus people who were not taking the medicines had less heart attacks. They found that it can slow the progression of dementia. It slows or improves autoimmune diseases, decreases inflammation. Now, keep in mind, though, that all of these studies were done in people who were taking a mid-range dose.
So those aren't on microdose levels.
They are not on microdosing.
Mm-hmm.
So if you think about what is microdosing is 1/8 of the mid-range dose. So if the way I talk to people about this is say, somebody has heart disease and you tell them to take a baby aspirin every day. What's the baby aspirin going to do? It's going to help decrease clotting,
Right.
prevent heart attacks, right?
Mhm.
The studies have shown that works. So if you tell somebody, let's cut that baby aspirin into 8 pieces,
Then it's
is that 1/8 of a piece actually going to give you the same benefit?
Right.
I don't know. I
Will
don't
it give you
know.
any benefit?
Will it give you any benefit? I don't know.
Maybe.
Now, we do have people who are taking microdosing. I personally have a friend who has irritable bowel syndrome.
Mhm.
She takes microdoses and swears to me that it really helps. It prevents her symptoms. I do believe in certain circumstances it can be very beneficial to certain people.
Yeah.
But don't get on this medicine as a microdose and think it's a miracle cure and all of a sudden you're going to get all the benefits that you've heard,
Right.
in the studies. I
Well
don't
said.
believe that's true.
I do think it's also a common misconception of people who, when they reach their goal weight,
They're like, I'm on
and they're like,
15
"Yeah,
now. I'm
what a
gonna
microdose," when they're at 10 milligrams of.
Well, I think a lot of people don't know what microdosing
Yes.
really is, because they'll be on 15 and
Yeah.
then they'll be like, okay, now I'm going to microdose. And I'm like, well,
Right.
you're used to 15 milligrams.
Yeah,
what is,
what is microdose?
Right,
Yeah,
like-
yeah.
Yeah, I'll tell them.
you might as well
like,
take nothing at that point.
you had to increase to this dose for a specific reason to get you to this goal. This is now what your body is used to. It is
Yeah.
used to this dose now.
Exactly. Let me clarify for those people who don't know what we're talking about. Microdosing, what it actually means is taking a smaller amount than the lowest dose. So if we're talking about tirzepatide, the lowest dose is 2.5 milligrams. Microdosing would then be 1.25 milligrams, which is a very, very small dose. I personally have taken that for a long time for maintenance because 2.5 milligrams makes me lose weight. I don't want to lose weight. But I take 1.25, it helps me maintain my weight.
Mhm.
And I totally believe in it. I'm fine with people doing that. But do it appropriately and work with somebody who can tell you why you're doing it, help you understand why you're doing it.
Yeah.
Right?
So we have a follow-up question, which I think you kind of already covered, but what dosage is considered a microdose?
Well, it depends on the medicine, but it would be half or at least half or less than the lowest dose that's prescribed. So it's like you were mentioning.
For weight loss.
For what? Yeah. But what I suggest to people who want to do microdosing for reasons like anti-inflammatory reasons and other benefits, start at the lowest dose and then increase that dose until you are not losing weight and you're not having symptoms. Once you start having symptoms, nausea, constipation, other issues, or you start losing weight when you don't need to, that dose is too high. So you can say microdosing is starting at extremely low dose and continuing to move up until you find the right dose that works for you. Because we all know that these medicines work so differently for different people.
It does. Which brings us into the conversation of maintenance. So I think when a lot of people approach me and they say, I want to microdose on this stuff. And I'm like, the conversation, I ask questions and it usually turns into maintenance. These patients want to maintain. How do I maintain? The question should have been, how do I maintain on this?
I think they hear the word microdose on
Yeah.
TikTok and it's like the trendy
And with these people on
word.
TikTok, when they say microdosing, what they're really talking about is maintaining.
Some of them. I think some of them have no idea what.
No, I think
But for example, I have a patient I have a few patients actually. They have no business losing weight, but we have them on very low doses, and I have proven that their kidney function has gotten better through lab work. I have proven that their inflammation has gotten better. I've proven their lifestyle has gotten better. And in those specific situations, it is appropriate to give this medicine in a low dose, microdosing fashion for maintenance.
As long as they understand why they're taking it and what benefits they're getting. You can't just take a medicine like this and just say, oh, I'm doing it because I'm going to get all these wonderful benefits. Right. Not that.
Yeah. All right. So we have another question in the chat. Is it safe to do intermittent fasting while taking a GLP-1?
No, absolutely not. Do not do that.
Please. No.
Because everybody wants to do it.
Yeah.
Intermittent fasting, it's a fine diet, okay? Not on a GLP-1 though. The whole point with intermittent fasting is to fast and then to have a period of non-fasting where you can get all your nutrients and all your energy in and your body wants to take it all in. This medicine does not allow you, let me say it slower. This medicine does not allow you to eat a large portion at one time. So therefore, if you intermittent fast and then you sit down to eat your non-fasting meal, you're going to eat too little. You're going to starve yourself, and then you're going to start feeling bad. You're going to start having more side effects, and you're going to start gaining weight. Because when your body goes into conservation mode, it doesn't want to burn anything. It wants to hold on to everything. That's my answer.
I feel like you may lose weight.
You're gonna lose muscle.
You just make weight loss, but it's not sustainable.
That's what I was going to say. I've seen patients who've been on intermittent fasting and they end up losing weight early on and then they plateau and they can't get beyond that.
Yes.
And a lot of that is because their body is now storing, and it's all it's going to do is store, and you're working against yourself.
And would you say you're probably losing more muscle at that point?
Yes.
So fat loss,
Which that's another problem. I mean, that's something we should definitely talk about. You hear about muscle wasting, and TikTok is always talking about how these medicines cause muscle wasting. The medicine does not cause muscle wasting. The medicines don't affect the muscle. It is the lack of protein.
Yes.
You cause muscle wasting.
Sorry, not sorry. You do.
Well, and I think that brings a lot of people don't realize when they take this, they have to actually change their habits.
Yeah.
And and I think a lot of people come on this thinking they just take a magic injection and they don't
sit on the couch and you turn into a supermodel in a couple months.
Right. I wish that was the case.
Yeah.
Absolutely.
All right, so we have a question. I hear you will lose hair on GLP-1s. Is this true?
Same thing. Yes, you will lose hair if you don't eat appropriately.
Yes.
It's the same thing as the muscle wasting. The medicine itself does not affect the hair follicles. It doesn't. The problem with the hair loss is two things. Rapid weight loss can cause stress on your body, and that can cause hair loss, which is temporary. It will come back. However, also poor diet. The lack of biotin, the lack of minerals, the lack of protein causes hair loss.
And
if you eat appropriately and you get the appropriate protein and you get enough fluid, you're not going to see that problem.
I always saw my patients, like bariatric patients, go through the same thing with their spots because they're going from their stomach size and they're physically cutting out your stomach and making it smaller so you can eat smaller portions. Same thing with the medicine. You can't eat as much.
And
Yes.
we do have stuff that we can talk to you about that can help counteract that when it's happening, if it happens.
But the main thing that people need to understand is it's not the medicine. It's not the medicine. It's not a direct.
All right, we have another question. So, someone wants to know, is a protein shake okay for breakfast? It's the only thing that they can get down that early. And if it is, what are some other recommendations y'all personally will recommend?
I'd rather something than
The
nothing.
solids.
Right.
I mean, I tell patients, obviously, yeah, protein shakes is better than nothing.
Better than
Better
nothing.
than nothing.
But I
Yeah.
always say I
Eat-
prefer you to eat a
I
salad.
know, I would
And then
say-
incorporate a carbohydrate in with
Yeah.
it also. So
Yeah.
like
I say
Piece of toast.
I say
Something-
protein shake, piece of toast, piece of toast and peanut butter. You have a good fat in there, you have your carb, and you have your protein.
That's how people, even if you don't like, even if it's a breakfast, because sometimes the patients are like, well, I don't like, breakfast food. It's like, well, eat something that's non-breakfast food.
Right.
Like you don't have, it
Eat
doesn't have to
chicken
be bacon and eggs.
Parmesan.
I mean,
Don't care.
I think you can finish sandwiches from bread
Yes.
What I personally do though is I like protein shakes, and I used to hate protein shakes.
No, I
Now
cannot
like
do
protein
them.
shakes. But the way I like was as a kid, I grew up loving cereal, but I can't tolerate milk. I started putting protein shake.
Has your
Chocolate milk.
It's amazing. It's so good. No, I use the
Fruit Loops?
I use the banana. I use it.
I
Yeah,
would,
it's
I would ask that person, do you drink coffee every morning?
The protein,
I tell them, they say yes.
there
When
it's
you're at the
made
coffee shop, get a bagel, get
Get a
a
bagel.
Spanish and feta croissant, get the
Avocado
muffin.
toast.
Get some
Yeah.
carbs.
Okay.
Your patients that do plateau, a lot of times you say, okay, well, what are you eating for breakfast? That's the first thing.
Nothing.
And
Coffee.
it's a protein shake, and it's like they're doing, and it's like, well, I think you need to incorporate a carb now.
Usually I'll be like, eat toast or I have a bagel.
Yeah.
I'm like, I'd rather you eat the,
fancy.
right. And I'll tell them I'd rather you drink a protein shake than nothing, but try to get like, physical food.
But another part to that question was they what can they tolerate? That was a big part of that question that I heard. So some people, they wake up and they're just not hungry.
Yep.
But you gotta try.
Mhm.
A banana, okay? A banana's enough. It's full of carbs.
Yep.
Try something.
Yeah, that
You gotta try.
All right, we have another question. What's the best time of day to take the meds?
That's a good one.
that's a good question.
I don't
Actually, I don't
Don't-
know that- Just stay
I tell people from my personal experience that when I first got started on this, there's truly no scientific thought process behind this, but to avoid side effects, I would do it at night and hopefully sleep through the side effects.
Yeah.
So
They used to make me sick, so I would try to take them like in the eve. If I took them too late into the night,
Then
then
you'd sleep.
I'd wake up by the time the side
right,
effects.
right.
So I would try to take them in the like late afternoon, but I think that was just making my mind feel better than actually like,
Right. There really is, I don't think, any time.
Yeah, it's not a
scientific.
specific time that I'm aware of.
Yeah.
But I've heard, just like you said, I've heard a lot of people say that they will take it at night before bedtime to
Mhm.
help alleviate symptoms.
Yeah.
Personally, when I took it, and most of the people that I talk to don't really have symptoms right after taking the shot.
Yeah.
Mine take mine would
Few
take
days.
48 hours,
Yeah.
24.
Days.
Yeah, 24 hours I could feel it. 48 hours, like.
Hours to 48 hours.
Yeah.
48 generally.
Yeah, that's what I
That's
heard.
true.
And
I
to
also never
clarify-
had side effects. So.
And to clarify, this is a once a week injection. If anybody's wondering.
Yes.
Out there, this is a once a week injection. We are not talking about every night.
So we have
Oh,
a
God.
question. So how does one get labs done for hormones or GLP-1s?
Come in and set up an appointment.
What about GLP-1s?
Well, GLP-1s don't require labs, and there are a lot of clinics that are doing lab work. I can tell you, before we start anything in our clinic, I talk to our malpractice company. I don't take any steps without talking to them because we want to make sure that we're covered and we're doing the right thing. And when I talked to our malpractice company, we started this probably before most any clinic in the New Orleans area. And it was new. The GLP-1s had a lot of information behind them, a lot of research behind them at the time. And I had to talk to the risk management person. And she said, okay, what labs are you going to do? And I said, we don't need any labs.
Right.
And she said, well, people can get pancreatitis. And I said, well, they can get pancreatitis, but you don't check labs periodically to look for pancreatitis.
Right.
The first thing that happens with pancreatitis is pain.
Right. You get the symptoms
The lab-
before the labs change.
Yeah.
So yeah, you don't start out checking out the lipase on somebody to see if they can take the medicine. And she said, well, you know what? This is a medicine used for diabetes. And I said, we're not treating diabetes. We're treating weight loss.
Yep.
I am not trying to diagnose anything. I'm treating weight loss. And there are very few contraindications. People who have renal failure can take and should take these medicines in some cases. People who have cardiac disease, people have, what lab would you take? And I said to her specifically that, you tell me what lab I should order. And she thought about it a second. She said, there isn't. There isn't. You don't need labs.
Yeah.
But clinics do it all the time. I don't understand why.
What labs are they
I think it's
actually drawing?
Right.
yeah.
Like a
They charge you money for it, and that's why.
Yeah.
What?
like what labs would they even be drawing? Like at some of the other clinics?
They draw basic CBC.
Yeah.
Unnecessary doesn't help with anything.
Not gonna change how we treat you.
No.
Right.
All right. What do you suggest for patients who have lost weight and are now dealing with loose skin?
That's a tough one. That's if you lose a lot of weight,
You're gonna.
Yeah.
There's not a lot you can do with that. We have some procedures that we do that can help tighten up skin. In some cases, the younger you are, the better they work because the more elasticity you have. But in some cases, if people lose a lot of weight and they have a lot of loose skin, plastic surgery, that's one thing. Time
and plastic surgery.
Yeah.
I also think it's important to emphasize
Exercise.
aside from
While you're losing.
it is a natural thing that will happen, but a lot of times too, it can happen when you're losing weight too rapidly.
Right.
And patients want to lose. They're like, oh, my friend, she lost 10 pounds in
2 days
or whatever. And it's like, that's probably true, but you really don't want to lose it that fast. You really only want to try to stick to 1 to 2 pounds because that is what helps your body use the changes that fast. And it kind of helps to prevent some of that rapid weight loss and the loose skin and things.
With the hair and
with it.
muscle
Yeah,
loss.
it's all,
Yeah, 1 to 2
it's all in
pounds a week.
conjunction. Hair loss.
It really depends on how much loose skin, what you're talking, because some people will go, oh, look, my skin's a little loose.
Yeah.
That can be improved, and it will naturally over time improve in most people. But people who we've had people lose 150 pounds.
Yeah.
That's a lot of weight loss.
Yeah.
You see it in the face too. You see it
Yeah,
in the
if they've
face.
been that heavy for a long time, it's really tough.
Really, yeah.
But
And you see it in the face too.
Mhm.
You definitely see it in the face.
So we have another question, which kind of brings us into the plateau talk. How long is too long for plateau?
So be friendly.
Oh,
what do y'all think?
3 months. No, wait, too long?
Too long. How long is too long?
When does somebody have a
So 2 weeks.
I mean, 3 months.
And is a plateau
I'll
normal?
give them 3 months to have a plateau.
plateau is
And a
normal?
plateau is normal. I think a lot of
Yeah.
people don't realize that.
Yes.
It's when it's gonna happen.
okay. I will also.
plateau.
I say this from a personal standpoint because I have been on this for I don't know, going maybe on 5 years now at this point. I don't even know that I still have the desired effects from this medicine. I still get full faster. I don't have cravings. I tell people all the time I could have eaten cake for breakfast, lunch, and dinner without this medicine. Like I was consumed by the thought of sweets and cake and all that kind of thing.
And the whole cake.
The whole cake. Matilda, my inner Matilda guy will come out. And I don't have that. So everything is under control, but
You're not losing.
I am not losing. And I tell people when I was in the thick of losing consistently, unfortunately, I hate to say this, I was working out consistently. I was in a gym with no AC, but I was working out consistently and the scale was moving. And I also tell people too, the first 6 months of me being on it, I didn't eat breakfast. I lost 12 pounds. That is painfully slow. The last 6 months, the second 6 months I was on it, I started eating breakfast and I lost 25 pounds in that amount of time. So that also shows playing the part of the breakfast, but I've probably been in this plateau for probably the last 2 years now. I feel everything I should feel. I do not need to do any kind of dosing change. I don't need to make any changes, but it's just not moving. So then I also will tell patients, I know it's frustrating, and you're coming here weekly. And if your body is telling you, and if you're unable to work out and make those suggested changes, and your body is telling you, like, we are at our max here, your body's already maintaining. So let's just go into maintenance mode and let's start doing this every other week then.
Well said.
Every other week.
Well said.
One thing that I've heard and I've noticed also, at some point, most everybody is going to plateau. Your body gets used to this medicine like any other medicine, and it resets. Okay, so there is a certain weight that our body wants to be. And the only way you're going to overcome that sometimes is exactly what you're saying. Start working out, start doing things you don't want to do.
Yeah.
And I've had patients, I don't know if you guys have, but that have told me that they plateaued after 2 years or so. And what am I doing? How come the medicine's not working? Should I go up on the dose? No. The problem is that when you're on the medicine early, first of all, more people are going to lose weight more rapidly, but also you're so happy that you're losing weight, you're changing your diet, you're watching what you do. Then you're on it for 2 years and you're just casually going back to your own.
You're not doing all the things.
Not paying attention, not just hoping the medicine is going to be a miracle.
Yeah.
And that's not what happens.
You gotta
it
put
happens too often with people. And what is the time frame that we see so many people plateauing? It's around 1.5 to 2 years on the medicine. All of a sudden, oh my God, it doesn't work anymore. And then they start trying to up their dose, and it's just not going to work that way.
So what do you recommend them do if they feel like they're in a plateau? We have a few people tuning in and saying, what are some things I can do to try and reset how the meds work for me? Or we've had someone with his appetite for over a year. It's not higher or lesser, but what should they do?
No, it's really
It hasn't and hasn't been for me.
Yeah. It's got to be an individual thing. You need to have somebody you're working with, like one of us, that have had experience with it, and then try several different things. You can do, like Luke was just telling me, tolerance break. It means back off the medicine, give it some time, but you have got to maintain your weight. If you gain 10, 15 pounds backing off the medicine, now you've got to overcome that. And the medicine's not going to work as well.
Yeah.
So you can't really do that. But a lot of it is just environmental changes. Get in the gym. If you really wanting to lose this weight.
Easy to say, hard to do.
Put the effort into
It's
it.
easier for them.
The medicine has gotten you this far.
And if you do back off and you know you're starting to gain, you know the medicine was actually still working while you were on it, even though you were in a plateau, you weren't necessarily losing,
Exactly.
but it was still working to some degree because you were staying the same.
For some people, the answer is increasing the dose.
Right.
Not for everybody.
Not for
That's really not what you do. You have to pay attention to what you're doing, what you're eating, if you're exercising.
I do. Go.
And just to put into perspective, as far as protein intake, that the actual recommendation of how much protein someone should be taking in is whatever your goal weight is in mind, is how many grams of protein you should be taking in a day, which is very hard while you're on an appetite suppressant.
It's a lot.
Consistently losing weight.
Yes.
It's a lot.
But I will tell people, in majority of the times that I talk to them, that okay, do what your daily eating habits have been. Do that for the next couple of days, but I do want you to pay attention to how many grams of
I tell
protein
mine
you're
too. I
taking
said, see where you're at
See
now,
where
so
you're
you know,
at.
so you know where you need to go.
Yeah.
It's between 1 and 1.5 times your weight in kilograms.
Yes.
A day.
It's a lot.
It's a lot.
It's hard.
And majority, probably us included, are not eating that much. So
and my Javi Clear protein coming from that.
when you're really in this plateau, that might be the dietary change that needs to be done to keep you going, because you have gone through your lean mass loss, your fat loss, your body is putting along on fumes at this point.
No, I have had some patients that they're like, I'm doing all the things, I'm working out, whatever, but my weight's staying the same. But I do feel like my clothes are looser. People are still commenting. So I gotta tell them, well, your body's, you have different body composition. You're losing the fat, but you're slowly replacing it with lean muscle, which it takes up different volume in your body.
More than I do. I say it's very possible to lose inches and not weight.
Right. Well, I should tell them why.
People get stuck on the scale.
I say that doesn't tell you anything about what your body's made of.
The point is to try and be healthy.
Yes.
Right? And of course, a lot of times people are stuck with, I need to lose 5 more pounds. But like you're saying, if you're working out, you're gaining muscle mass. Muscle weighs 3 times as much as fat.
But it takes up less room in your body than fat. So
for the amount of
just to make sure that we've answered this person about the plateau and stuff, that it's been clear, because I think we have so many people who obviously get to the plateaus that ask this question. Lifestyle change, patience, and
stress.
And what is
stress, cortisol levels, sleep, literally all of the good old fashioned things that.
And what's a plateau? Because people will come in and say, I haven't lost weight in 2 weeks.
Yeah,
I'm on a plateau.
Yeah.
So, but you hear it all the time.
Right.
That's for my 3 months.
So what are the questions you ask when someone says they think they're on a plateau?
Well, you've got to find out more information about the person. And one thing, we do have some people who are just grinding, concerned about that last 2 pounds, 5 pounds.
Oh, right.
Constipation. Constipation.
Water, how much you
When's the
drinking?
last time you
Yes.
visited the toilet?
Yeah, you can literally hold on to 4 or 5 pounds from
Yes.
constipation.
Mhm.
That alone. So you can't really look at the scale from day to day. Definitely.
You can weigh
Please don't
2
do
more
that.
pounds later in the year.
Please no. So every day.
So we have a follow-up question after the tolerance break that you said you could recommend. So when you get back on after backing off, should you go back to that same dosage or go back to the starting dose?
Great question. That's a fantastic
Yeah.
question.
That's good.
The answer is the latter. Let's go down in dosing. If it's been on average, I get a lot of patients that come in and it's been a year since I've been on this medicine, in which case I'll say, let's start at the low dose again. If a patient's been off the medicine for only a couple of months, that's a different conversation. That's something, I start asking about side effects when you're on the medicine. Because I have patients that take a month off and they go right back to their dose and everything's fine. Doesn't make sense, but everything's fine. And in that situation, we would allow the patient to, stay at their dose. But on average, the answer is let's come down in dosing a little bit, make sure you don't have side effects, and then let's start adjusting our dose appropriately to chase the appetite suppression down after that.
Joey.
If somebody came to you and said, okay, like, you propose, okay, let's do this, back off, let's stop the medicine to do this reset. How much time would you suggest them
Until
to?
the seasons change. Wait for a minute.
So give them.
Well, it depends on what you're talking about as far as research. This is something we were talking about before we got started, right?
Mhm.
Some people respond very well with this medicine. Some do not respond
Right.
well to the medicine. So you have to talk to the patient
Individually,
listen to their story. How long were they on the medicine? How long were they off the medicine? What symptoms, as he said, did they have? From what I've seen with both of these medicines, especially semaglutide, the tolerance lasts a long time.
Mhm.
So you can't get on semaglutide, be on it for 2 years, get off of it 3 months, and go back to the low dose. I mean, that's not, unless you were on 0.5.
Where
Yes,
you're on a low
Yeah.
dose.
but you can't get to 1 milligram, 2 milligrams, go off for 3 months, and then say I'm going to start all over again.
Right.
Again, it's not going to work.
Yeah.
I mean, it's not going to work. If you get off for a year, maybe. But I still think, and I've seen people retain tolerance for up to a year in some cases. I think less with tirzepatide. But,
Yeah, let's switch
I
to
agree.
appetite. It's odd, but I have seen it. It's
Yeah.
not, yeah, absolutely.
but you wouldn't go from a high dose, let me get off for 3 months, 6 months, now
And
let me
then
go back to the
start.
lowest dose and think you're going to get,
Yeah, in that situation, I would say, let's go down a dose, see how you feel, and then let's make some decisions.
Mhm.
And some patients will fight back with me a little bit, and they'll be like, look, when I took it, I felt fine, nothing was wrong. It was like no big deal." And then I'd say, okay, take your dose.
So basically, it's an individual
It's an
conversation.
individualized conversation.
With a lot of the medicine, it's like that.
Yeah.
We have probably a highly debated one. Question: what medicine do you see the most success on? It's very opinionated. But
It depends on the person.
Yeah.
It's such a tough one.
Yeah. Some people respond very well to semaglutide. Some have a lot of side effects, so
Yeah.
they do better on tirzepatide. Tirzepatide in the research and studies showed significantly more improvement in weight loss with less nausea. Nausea still had the same amount, or at least we see, I think, the same amount of constipation and reflux. But
And then I see things with tirzepatide I don't see with semaglutide. For example, injection site reaction.
Yeah.
That is something you see with tirzepatide
You don't
only.
see it.
You don't see it with semaglutide. I've started people on tirzepatide because we've talked about the studies. They read the studies. I've of course read the studies, and we put them on tirzepatide. A year goes by, and they're not getting the results that we really expected they would get. Put them on semaglutide, and everything starts working
Smooth sailing.
beautifully.
I think that if there
It's
was
individualized.
something I could wish in the perfect world that everybody would do in getting started, is that they all would agree to just start on semaglutide, because then you have the other ones
The stronger one to go.
to work to.
that's what I've told most people.
Yeah.
Mhm.
It's less expensive
Right.
and it can help you get
Yeah.
started if it's not working. But one of the problems I found, though, is a lot of people will start on it and then they take 2 or 3 weeks.
Yes.
Or
And they
they're
wanna change
barely,
medicine.
yeah,
Yeah,
they're,
they're like, it's not working.
they're not even giving it a
They
chance.
talk
Yeah,
about
give it a
that
chance.
family member, tirzepatide's better, I want to switch.
Or they
I'm
have-
like, if it ain't broke, don't fix
If
it.
it ain't broke, don't
Don't
fix it.
fix
We say
it.
that so much around. Yes.
And because what did we talk about just a minute ago? Tolerance. People become tolerant to
Exactly.
medicines.
Mhm.
So if you can start on semaglutide and work your way up on it, you still have big gun waiting
Big
in
gun.
the future.
Tirzepatide.
You know,
It's not gonna make you lose weight faster. You're not. I mean,
for some people.
it will, but it's still the goal is 1 to 2 pounds a week.
I
So-
feel like
5 to
really
10 pounds a month is how I like to say it.
I feel like really
For women, for men.
the only reason why I would really encourage people, or the two reasons to switch to tirzepatide or on semaglutide, the side effects, like we talked about.
Mhm.
And if they are someone like myself who wants cake for breakfast, lunch, and dinner still, and those cravings and the food noise are just not going away, even with dosing change, then tirzepatide is going to
Sure.
be the better
And the
option.
science behind that is that second peptide,
Yes.
the GIP. It was shown in studies to influence the brain activity a little bit more than the GLP-1 peptide was. So that's why they're saying that. But again, it's individualized.
Yes.
It's individualized.
Yes.
So we have another question. What advice would you give someone to prevent or treat constipation?
Ooh.
Fluids.
Water.
Water.
Let's make sure you get enough water
meals a day.
and fiber. What frequently happens is people don't get the appropriate diet.
Yes.
When you eat less, you also take in less
Less-
fluid. People frequently get dehydrated.
Mhm.
And if you have less fiber, you have that problem as well. So what is happening and causing constipation? First of all, the medicine is slowing the bowels down.
Mhm.
Correct.
You know,
Correct.
And-
Speed limit changes.
speed limit changes.
Point A to point B. It's 30.
You're getting dehydrated, your stool is getting harder, it's not moving as easily, it gets backed up, and then without the fiber, it's not going to move through as well. So you just that's the big key is make sure you
So-
drink enough and get enough fiber.
Coffee dehydrates more. Tea dehydrates.
That is,
more.
yeah.
We need water. Water, unfortunately, it's no fun, but it.
But I think too, like just the 3 meals a day. You see, even a lot of patients I talk to, I'm like, "Are you eating 3 meals a day?" And they're like, "No." And I'm like, "Well, like you said, it slows the bowels down. So if you're only eating 1 meal a day, it's not much going. That's
Pushing it to move it
You're putting a big plug in there.
Yeah.
Plug
You
it
will
up.
become constipated.
Yeah.
Yes.
So, but
So
water
what-
is definitely.
We have another question. What should you do, or what do you recommend patients when they miss their weekly injection?
Okay.
Next steps.
Get back to it.
Yeah.
Don't be so hard on yourself.
Yes. Yeah.
Say this is hard. I'm like, I always tell my patients, I'm like, how do you come here 7 days every 7 days? I'm like, well, my life, I could not make it.
I always say it's the horse you can hop back on whenever
Yeah.
you're ready. So don't beat yourself up. And people are like, I'm going on vacation. Go enjoy
vacation.
yourself.
Enjoy it.
Go eat that
Please.
croissant in France.
You're still gonna have the effects of the medicine, and some of that medicine is still gonna be in your body if you come back, 10 days
People in
later.
Europe eat like birds anyway. So
Yeah.
And you're walking a lot in Europe.
No, it's fine.
All right, this is a question probably for Dr. Scott.
Oh,
What if
okay.
you can't take HRT due to breast cancer? How to increase your estrogen level?
Well, the problem with breast cancer is that you don't want to have estrogen. At least that's the consensus right now. That you don't increase your estrogen level, but you can take testosterone. I can't say this enough. I say it all the time. Testosterone is a woman's hormone. Men make estrogen all our lives. Women, women make testosterone longer than they make estrogen, but for some reason, medicine says
Yes.
testosterone is not a woman's hormone. The hell if it's not. And it can really help women as they're going through perimenopause and menopause. It helps a lot of the symptoms. And a lot of the symptoms that women begin having in their 40s, which they start saying, oh, something's wrong with my hormones. It's testosterone. That's the problem. Your testosterone is dropping, just like men's, and you start feeling it before your estrogen even begins to screw up. And for some reason, I don't know why, but medicine is just gives such a pushback. Now, if you're on the East Coast or the West Coast, oh, they're doing it everywhere. But here in the South, no,
Right in the
no.
middle.
As a matter of fact, there was a study that just came out last month. They do very few of these, looking at women in testosterone treatment in perimenopause and menopause, and had great effects, very few side effects. It was a wonderful study. Thank God somebody's finally looking at it.
Yep.
It can help. So that's something.
That's an option. Yeah.
How do you know when constipation is a problem?
I
How
know.
many days?
When
has
it's
it
not
been?
coming out.
You feel bloated. You're.
If you feel like you're
Yeah.
a child,
I mean, I'm a
spoiler.
When you're in pain.
When you don't go for days and you have a change.
And you're in pain. Above the plug.
Actually, don't wait for.
Um,
You do normal.
Yeah.
When
What's your normal is our first question.
Yeah.
yeah,
What's your baseline?
What's your baseline? And then we go from there. And
Yeah,
Dr. Scott
just pain.
Dr. Scott, yes, and Jenna just said pain. If you're having pain, it's probably just your
If you're
body's
feeling
saying something.
bloated, uncomfortable.
if you feel like it's there and nothing's happening, then
Yeah.
Call us and talk
There,
to
there
us.
are medicines you can use. We use Linzess frequently in
We'll
patients.
describe it for you.
All right. Has anyone had a side effect of gout with tirzepatide?
Yeah.
No, not that I've heard of. It's I know some people who have gout that take semaglutide and have incredible improvement because of it, because of the decreased inflammation. I haven't heard about that.
I
We
haven't.
can look at it.
Yeah.
No.
I'm just curious.
I've had a couple of patients that actually have seen improvements with their gout, symptoms with both of these medicines.
Mhm.
We can include tirzepatide in this conversation on that.
All right, we're gonna do a little rapid fire.
Start
So
with
Are
Ashley.
we there already?
no, but I wanted a rapid fire for some nutritional, like what y'all's go to. So I want to go around starting with Ashley. What's your go to recommendation for breakfast when it comes to a patient? Like, what's your first like?
I say oatmeal if people like it,
Mm-hmm.
just because it's full of
They
fiber.
have
It's
protein
fast.
oatmeal. They do.
Yeah, fiber. Quick.
For breakfast?
Mm-hmm.
Anything that you like, because I just want you to eat it.
I agree with that. I say, what do you
Amen.
think?
Bagel, and a lot of my patients will say like, "Oh, I'm toting kids off. I'm trying to get to
Yes.
work." I'm like,
Yeah.
whatever you can grab and eat.
Take
and
care of
then
yourself.
grab bread, bagel, protein waffles,
Makes
literally anything.
Yeah.
Anybody have other
Toast and
recommendations?
jelly.
Toast and
Bagel.
jelly.
Bagel, yeah. Eggs.
some people
Avocado.
get a dozen of eggs, boil them things at the beginning of the week,
Mhm.
and take your boiled eggs with
I
you.
just mash an avocado in the
Yeah.
beginning of the week, add in a little spices, whatever, and then put
Oh, I love
toast in.
avocado.
I love avocados. So I'll make it ahead of time and douse it with lime juice so it stays fresh. And then add it on
Make
some
something
toast each morning.
Yeah.
It's
I've
good.
never done that.
Yeah, I've been doing it, and my girls love
I've
it
heard
too.
of lime juice. Yeah.
All right.
Ooh,
we have
lime
a
juice and
question.
everything but the bagel.
Is the Mediterranean diet a recommended diet on GLP-1s?
Yeah, I love
Yeah.
it. I think it's a great
That's
diet.
right. Good fats, protein.
Yep.
Big fats.
Do it.
Do it.
All right. Next to our rapid fire. What about lunch? What's y'all's first recommendation?
Oh, I hate lunch.
I like rotisserie chicken and vegetables.
Trader Joe's, they have the little
Shout out
chicken that's
TJ.
normable, and what a salad. And
Wait, which ones?
the protein. The chicken that's in the
Like pre-cooked.
Yeah,
Oh, the Greek-cooked, like
Yeah,
that.
I already ate it.
Amanda loves it.
Mhm.
But
That's
just
sounding chicken, right? I tell people,
Yeah.
I'm like, just
chicken and
eat a carb,
veggie.
and I'm not a carb. I'm sorry, a protein and a veggie, and if you have a little carb in there, it's totally fine.
Yes.
When you start stressing over,
Yeah, that's when it.
what am I
it gets
supposed to specifically?
You're
eat?
never gonna
Yes.
that's not gonna be sustainable.
No.
Yeah.
Yeah.
If you eat sandwich, that's
What do you like?
Nothing.
Yeah, so in that situation, that's where the medicine comes into play. The medicine is here to help you stop eating and get on with your day. We're trying to get people out of finish your plate, become part of the happy
Right.
plate
But
club.
we really do. They do need to concentrate somewhat. If they're going to eat breakfast, they're just going to have jam and toast. They've got to
Protein
get something.
Right.
Yeah,
Right.
you
So
have to get some protein. And for
protein
lunch,
shake
you
would be
have
my
to get
answer for
fiber.
rapid fire.
Yeah.
Something, at least
Yeah.
something. Put something in. Protein shake if you're not hungry.
All right. So we have one. What's the most underrated habit that you
Eating a protein.
Eating.
Eating.
Sleep.
Sleep.
Sleep. I think that's a good one.
Fluids.
Drinking enough water.
Okay. All right. So you've all seen people who are successful. What about the patients who struggle? Are there patterns you tend to notice in people that struggle versus people that
We
are?
keep saying that.
They don't eat.
Not eating.
Impatient too.
One of
People want this to go
Yeah.
quickly.
they want to.
Yeah.
They hear from their friends that
They hear from their friends.
Yeah.
Or they'll say they're eating 3 meals a day, and then when you get to it, oh well, I had like a half an apple, then I had like a piece of turkey. I'm like, okay, those aren't 3 actual meals.
Fair.
Even though they're eating 3 different times a day, it's not,
And
Not enough.
people just are not eating enough in general. I think.
And I feel like a common question I get, which this is kind of a sidebar, people ask when we're like, okay, you need to be eating X amount of protein. Where they're like, how many calories?
Yeah, they're very
That
set on the
depends
calories.
on the person, the age, the gender,
The activity.
hormones, your activity. all of that it
Keep
cannot
it
be
simple.
said specifically to you, and it's not something to worry about because this medicine is
I'd say
controlling that
focus on your
anyway.
protein.
You're already
Protein, fluids.
Yeah.
Keep
3
this
meals a
simple,
day.
guys.
Meal
Yeah.
deals.
Keep this simple.
yes.
All right, we'll go back to our rapid fire. But this will be for everyone. So y'all can just kind of say what you think that first comes to y'all's mind. What's one thing you wish patients would stop doing?
Comparing
Comparing to other people.
Compare themselves to their friends.
Just think to the friends.
Yeah.
TikTok.
TikTok.
All right, what's one thing you wish patients would start doing?
Listening to us.
Right. Taking our recommendations.
Yeah.
Exercise.
Yeah. People do not like it when you bring up.
Ladies, let's go.
Are you exercising?
Hot girl walks, you know, just a little 10K walk, a little 10,000 step walk. Go for a hot
That's 10,000 steps in.
Yeah. All right, what's one thing patients worry about too much?
The scale.
The scale, the number on the scale.
Number on the scale.
Or losing weight too fast. Or just, yeah.
Oh, not losing it fast enough. That's what you're saying.
Or yeah, I mean, yeah, not
Okay.
losing it fast enough.
That's what you're saying. I'm losing too much weight.
We have a question. Let's go back to our questions. We have a question about clarifying the amount of protein you should eat related to your weight. So if you weigh 160, do you do 160 grams of protein or what is?
No.
Is
It's
it like-
kilograms. So it's 1 to 1.5 times your weight in kilograms.
So divide your weight by 2.2.
Yeah, divide your weight by 2.2 and then at least that much.
I know. Well, get your calculators.
Protein
Everybody's got their calculators out right now.
All right. What's one thing that patients don't take seriously enough?
These are all the same things.
I feel like it's all repeated.
Yeah.
Protein, sleep.
Protein, sleep,
Exercise.
fluids, breakfast.
All the things you
Eating
don't want to
appropriately.
change.
All right. For those of you who've been doing this for a while, what has changed the most about the way you think about weight loss?
Ooh,
It's
that's a
not the
good one.
same for everybody.
Yeah.
Right.
Yeah. It's, you got to treat everybody individually.
I will say, and I say this all the time when I see patients, seeing these the amount of patients that we see every day has made me realize how much alcohol unfortunately affects the scale. In that if you're a daily drinker, unfortunately you will see results more if you cut that out.
When I was on
Unpopular opinion, I'm so sorry, but
You live in New Orleans.
When I was on tirzepatide, it made me not want to drink. And I know maybe I'm more in the minority of that, but like I loved wine, I loved mixed drinks and all that. And my friends told me I was so boring after I started it because like I just
It does.
did not have the wine,
yeah.
which helped. I think me lose the weight because I wasn't drinking.
But I think hormones too. Like I never until I started working here, I did not realize
How much that plays.
your hormones affect you. It sounds kind of scary.
We have another question. They understand that you should not have carbs at night or try to avoid them, but what about fruit? Would you recommend fruit at night?
Fruit is sugar. Fruit is sugar. If your body has sugar to burn, it will not burn fat. It's that simple. So even though fruit is healthy, it's nature's candy. It is sugar. I think it should be reserved for the morning, is my opinion on that.
I don't disagree with that.
All right. So if everyone watching tonight remembers only one thing from this conversation, what do you want it to be? And we're gonna go one at
Say
a
it all at the same time.
We're gonna
Say it all at the same time.
One last piece of advice. Who wants to start?
I think we're gonna all say the same thing.
I think just your journey is your journey, and you just have to be patient, and it's not going to happen overnight. You can't listen to other people. You just have to be patient and do what you're supposed to do, and it'll happen.
I like that. Yeah. You're an individual.
Everyone agree?
I would say this does not burn fat. This is supposed to put you into the caloric deficit by suppressing your appetite. This medicine does not physically burn the fat for you. A higher dose
does not mean
more fat burned in specific
or
areas.
also.
I tell people two things. Remember two things out of this consult with me. Stay at low doses as long as possible. Make sure you're eating enough. Have a nice day.
Okay. So, and just stop chasing the scale. You know, just if you have a belly, get into 100 pounds won't make the
The belly go away. Yes.
And that's how people take pictures of yourself, like throughout. Like sometimes when the scale doesn't move as much, you can still see the result. Or like take your measurements, or like other ways to measure your success than just
the scale.
because the scale doesn't tell you how much fluid you're holding on to or anything like that. And then
jeans or something go off of how they
yeah, like
We have one quick question. Can you give short insight into inflammation with GLP-1s?
They help. I have patients on this medicine that have, again,
For
that
that.
have no business losing weight, that we control their inflammation with very low dosing. And this is where the microdosing conversation comes in. And they respond well to inflammation.
I feel like even patients like that come in like orthopedic, you know, like, oh, my joint swelling's back.
Gastrointestinal inflammation.
Yes,
Irritable bowel syndrome is improved.
No, I've had so many
Crohn's
patients say that.
disease improve
Yeah.
patients.
Yeah. It varies patient to patient, but most will get some improvement.
Breast cancer. We have patients who are currently going through treatment of breast cancer or other cancers, and their oncologist is telling them
To get on.
stay on it.
Yes. They've seen some really good improvement. There was one study.
Didn't they have
actually,
a recent, right?
Yeah, the study recently that showed tumor size decreased.
Yep.
That would mean
And
actual
age
effect.
Yeah.
That's pretty
Major.
Yeah. How much time do we have left?
7 more minutes.
So is there anything?
We got one more question.
Okay.
Can a bariatric doctor use GLP-1 to lower their BMI before plastic surgery?
Yes.
Yes.
We had the
We've had that happen a lot. Yes.
Do you have any other pieces of advice?
Do you guys have anything to talk about? Anything we missed? What are your favorites? What are
my favorites?
Biggest issues?
Biggest issues.
Other than the eat.
I really like what that you just took it away. I really like what Ashley said. Don't chase numbers on the scale. I cannot. It's hard. It's hard. I get it. And it really gets in your head. I call it the anxiety tornadoes. I feel like the scale just gets the anxiety tornado spinning, and it just
responds to it.
Let's make this simple. This medicine we finally have a medicine that can help weight loss be a lot simpler than what it has been for the past couple of decades. But let's use it correctly. It's my last thing.
Exactly. Like maybe not almost everybody, but a lot of people are going to plateau. And when they do, you just can't stress about it and say, this is the end of the weight loss. No, don't quit. It may take time. You can be, like you said, plateaued for months or years.
Good to bring up. If you do need to stop, desire to stop.
Maintenance. I feel like
don't stop cold turkey.
Don't stop. And you do have to have the realistic conversation with yourself. What is your lifestyle going to have to be now to keep the weight off? Because if you go right back to what you were doing before the medication, then yes, you're going to gain it back, unfortunately.
I tell them, use it as a tool while you're on it to change those habits over time. Then when you get off for whatever reason, you're not fighting your old bad habits.
There's no medical reasoning of you have to stop taking it.
People
can't be on it.
People ask that a lot too.
What's the long term? If somebody ends up with pancreatitis,
yes.
But that's it. There's so few contraindications. But other than that, no, you can stay on this the rest of your life.
Because a lot of people will ask that. Well, how long is it safe? Or
safe? These medicines have been around, and that's a lot of people don't realize. These medicines have been around for decades.
Right.
Now, the semaglutide and tirzepatide, semaglutide has been used since, I forget. 10 years. Yes, 10 years. Really? Prior to that, it was liraglutide. There's just so many. The same medicine, they bind to the same receptor. They were just daily injections, not the weekly injections. These medicines have been around for a long time.
Decades.
How do you think these actors go from overweight to skinny and cut 20 years ago? They were doing it. People didn't talk about it, but yeah, it's
you see all my mom.
You're beyond. You know your secret now.
Plump on off season, and then when she goes,
I can't believe you brought that girl in there.
Beyonce, don't come for us, girl.
I love Beyonce.
I love Beyonce.
Yeah. All right. Well, Beyonce's not on the webinar.
I think you always look skinny, Beyonce.
All right. Well, we want to thank everyone for joining with us. Stay tuned for next time.
Let us know if you want more.
Ashley, Bree, Luke, Mace, Maddie, and Alyssa. Thank you all for joining us, and we'll see you next time.
Thank you.
We survived.